Which one? Well, hello, good afternoon, everyone. Thank you for joining us. We wanted to give everybody a chance to get started, and I hope that our music has finished playing here. We welcome you kind of to our second opportunity with the Pacific West District Korea. What we really wanted to do is take a second this evening to follow up with communication after the first week and a half or so of school back in person. So we have a team here from Pac West, and we're going to take just a second to go around and let you know who's here. It'll be really quick, and then we'll move forward with some of information for you and some questions and answers. So my name is Jeff Arrington, Superintendent of the Pacific West District.
And I'm Dr. Helen Bailey. I'm the Community Superintendent for the Pacific West.
Elise Truce, Principal at Humphreys West Elementary.
Yeah, good afternoon, Joel Graham, Chief of Staff.
I'm Colonel Mike Cohen. I'm the 8th Army Surgeon.
Stacy Lamoureux, I'm Assistant Principal at Humphreys Middle School.
Teresa Hahn, I'm Assistant Principal at Humphreys Middle School.
Hannah Choi, Principal, Osan Elementary School.
Tiffany Bryant, Principal, Humphreys Central Elementary School.
Wanda Bradley, Principal of Osan Middle High School.
Erin Graysack, Principal at Humphreys High School.
Mandy Schwert-Johnson, Assistant Principal at Humphreys High School.
Edgar Romero, Assistant Principal, Osan Middle High School.
Mr. Gray, do you want to take it from there?
Sure, and this is Al Grade and Dr. Beach from Daegu Middle High School. Hello, everyone.
Dr. Ware?
Hello, and I'm Dr. Ware, the Assistant Principal at Osan Elementary School.
And I think we caught everybody. We have Dr. Roberts Penpen and Dr. Ms. Razi, you want to say hi just real quick? They are providing all of our technical support this evening. We really appreciate them. Okay, they didn't say hi. That's okay. We welcome them anyway. So we've been in school now. This makes 8 days that we've been back in person, 5 last week and 3 this week. And we've certainly had a lot of lessons learned, but I guess most importantly, before we start kind of answering some of the questions and providing some of the feedback that we've gotten as far as to share out, the one thing that we found consistent across all 8 schools was that the kids were absolutely wonderful. We've had lots of things that we kind of forgot 9 months ago that were part of the routines as adults. Car lanes and drop-offs and notes and all those communication things. But in the midst of all that, in every school, the kids have been absolutely wonderful. We haven't really had any concerns with masks, barriers, behavior. They've just been wonderful. So not only were we missing them and wanting them back into the school, but having them back really reminded us of what they do for us in our lives, how important they are, not just to have a job, but to give us the things that we need as educators to keep us going and do the best we can for them and their future. So I think that's probably the most important message that I can provide, is how wonderful the students have been in opening back up. Now, we do have some big people stuff to share and some routines and things like that and some questions to answer, but I think that was the most important piece. So we've got some feedback we're going to share with you, and these are kind of like reminders and lessons learned that we've had come up as important as we've reflected on the first 8 days. And then we're going to take a few questions at the end, and then we're collecting all the additional questions, and then we're going to post back the answers to those, because we can't of course, get to all the questions all the time. So first, Mr. Grimm, I think you're up with buses.
Yeah, thank you. It has been really fun to walk through the schools and see how excited the kids are. They are just great. They're just great. As Dr. Arrington said, they're wonderful. I'm glad to be back in school. I was able to go out to a bus stop as we open school back up, and just wanted to report a little bit on buses. We have 212 bus runs that we do peninsula-wide in Korea, with 3,162 students riding buses. That's a lot of students. And as I was talking with our student transportation director, he was sharing with me today that they were having a very good experience with the students. Kids are practicing good hygiene. They're putting on the hand sanitizers as they're entering the bus. And he was very impressed with how the students are keeping on their face coverings the entire time on the bus. No issues with that at all. There are some students showing up without face coverings, and we do give them a face covering, temporary one that they can throw away. But he did want to remind everyone to please make sure you check your children as they walk out the door in the morning before they get down to the bus stop, to make sure they do have a face covering on so they can get on that bus. So that's all I have, and thank you.
And I am here to remind everyone to ensure that you are updating your children's contact information for you. And there also needs to be an emergency contact during this COVID-19 season and the flu season. We may need to contact you to pick up your student if they have a fever or any other types of symptoms that will require them to be picked up. So please make sure that you're updating your contact information as well as your emergency contact information. The last thing that I wanted to make you aware of is the open period for selecting whether or not you are going to have your child do the participate in the learning environment for the DoDEA virtual school, or if you are going to elect to do in-person school for your child. The information is on the DoDEA website. It's also been posted to all of our Facebook sites. So it gives you information there in reference to the differences between the in-person school and the DoDEA virtual school. So there's a lot of great information there. Please let us know if there are any questions about how you're electing the learning environment for your student for second semester.
All right, good evening. We are so excited to have our students in our building. And it's very exciting to see them every day. We do have barriers for their safety. We have them in all the classrooms. Each individual student has it. We also have it in our cafeterias. And our custodial staff work diligently after each lunch period to make sure that they're sanitized and they're clean for the next group. And we're very fortunate to have it in all of our schools. To celebrate for our school, a celebration for our school is the students are really getting into the routines of following the mitigating measures, making sure that they have their masks on, washing their hands frequently. So we thank the parents for all your support and continuing to remind your students of the mitigating measures that we have in school. Thank you.
Good evening. It has been wonderful having students back at school. I think that one of the most positive things about having students back is how excited they are to see their teachers and their friends. I can honestly say that most students are genuinely happy to be back at school. I'm amazed at how quickly they've acclimated to being back in school and to their new learning environment. I think another thing I've really enjoyed about having students back is all of the unique and very fun face masks that everybody has worn, teachers and students alike. Some of them are absolutely hilarious. And speaking of face masks, I just want to talk to you briefly about the importance of students wearing face masks to school. Now that students are back, their safety is our #1 priority. We have many mitigation measures in effect to create a safe environment for students. Although all of these mitigation measures are extremely important, the two most effective ways to prevent the spread of COVID are the two most important tools that we have to prevent the transmission of COVID is wearing a face mask and social distancing. Unfortunately, due to limited space in the classrooms and throughout the school, sometimes social distancing can be, you can't hear me? Okay, sometimes social distancing can be challenging.
She's trying to tell you the camera's here, so if you'll look this way, they'll be able to see you towards the, yeah. So,
okay.
Yeah, we have video here that
Bailey.
she's looking at you guys, but.
That was easier looking this way. So essentially wearing a mask is really our primary method of the prevention of spreading the virus. So DoDEA has a policy that anybody that visits a school must wear a face mask. So it's critical to ensure that your students wear their face mask daily. And we enforce that with fidelity. We realize how difficult it is to ask students to wear their face masks nearly the entire school day. But wearing a mask not only protects them, but it protects their friends, their classmates, and anybody else with whom they come in contact. It also really protects your entire family. Now that we have students back in school, we want to keep them in school by keeping them safe. So we can all work together to keep our students safe by making sure that everybody wears their masks to school. Thank you.
Okay, Doc Cohen, you're up, and really we want to ask you if you could just talk a little bit about symptomatic clearance for our families and the families who are ill staying home, get sent home or ill staying home, and clearance to come back to school, the how, the why, maybe just how some information. Thank you, sir.
Great. Yeah, as Dr. Angel mentioned, I'm Dr. Mike Cohen. I'm the 8th Army Command Surgeon, and appreciate being invited to this room of principals and assistant principals. Especially nice to be around this group when you haven't done anything wrong. But thanks for having me here. And I think these are really important things that I'm happy just to discuss with you. And I just want to kind of refer to this the new normal, right? General Abrams, the military, the USFK community. Really, we're talking about a new normal. And the reason I mention that is the things that we're doing this year in regards to what to do when you're ill or when your children are ill are a little different than what we've done in the past. And I think it's kind of important to recognize that the first thing is if you have an ill child who is either sent home from school or doesn't go to school that day, we ask you that the whole family stays home until you can get clearance. And I'll talk about the clearance piece in a minute. The importance of this is that, we know that coronavirus is pretty sneaky and that people can have coronavirus and not have any symptoms. Or people can spread coronavirus even before the symptoms start. So it potentially could be if there is a sick person in the house that potentially has coronavirus, there could be other people in the house that have coronavirus. So I think it's important that the family stays home together and then contacts the medical personnel to get further guidance in regards to when it would be safe to go back to school or go back to work. And I would also add in that topic is that we do the same thing within our organizations. If there's someone ill at work, they'll go home, their family will stay home, and sometimes we'll even send the workplace home just until we get clearance that this is not coronavirus, that somebody might be either tested or cleared by a medical personnel. So that's an important first topic is, when someone's sick and they're at home, let's have the whole family stay home together. And now let's talk about the medical clearance. Your child's sick, wakes up in the morning ill and doesn't go to school, or evaluated by a school nurse and sent home. We currently have four methods of the ways to clear the child to get back to school or to be evaluated. Probably one of the most commonly used method will be our COVID hotline. So you can call the COVID hotline. The current operating hours, I believe, from 8 a.m. to about 6 p.m. And so you can call the COVID hotline, and there will be public health nurses that are available. They might just take your information and call you back. But the idea is that a public health nurse will speak with you and find out the information and provide further recommendations. And the recommendations could be come into the hospital for a test. It might be, hey, we think you should go to the ER or to your primary care provider, or they might be able to just clear you over the phone and provide you with an emailed document that says you're clear to return to school or to work. So that's number one, call the COVID hotline. Number two is anybody can be seen in the ER, the emergency room at BDAC. Of course, this is not necessarily relevant for DeGu, but also the emergency room at OSAN would also apply. So the emergency rooms are set up to evaluate people and also provide return to school clearance as necessary, as well as coronavirus testing if that's deemed necessary. And then number three would be just to go make an appointment with your primary care provider, and that could be your on-post military primary care provider as well as an off-post provider. And any of those visits would be able to provide you with some sort of note to return to school. And then for military healthcare beneficiaries, there's also an option to actually call, to leave what we call a telephone consult, where you would call the clinic and leave a message for your provider or for the nurse, give them the details of the situation, and a provider generally will call you back within a short period of time to get the information and then make a decision there. Okay, the same thing with the hotline, whether you can return to school, whether you need a COVID test, or whether you just need to be evaluated by the doctor. So those are the four methods that we have right now: COVID hotline, ER, a primary care visit, or a telephone consult with your primary care provider to provide the clearance. Hopefully in the near future, we'll have some other opportunities, some other options that might streamline the process a little bit, that will involve some online ability to access the doctors or the public health personnel. So more to come with that, and hopefully in the near future, we'll have even more options and even more efficient options to help get the students back into school in a timely manner, but in a safe manner where they're cleared by medical personnel.
Perfect. Thank you, sir. All right. Ms. Struess, Parent-Teacher Conferences.
All right. So to talk about Parent-Teacher Conference, which is one of our favorite times of the year, where we get to talk with each of you about your child at an individual level. Love having the kids come back and be at the school. We've been able to spend this time getting to know them, doing some assessments to be able to determine their level. And so during Parent-Teacher Conference, we're going to be able to communicate your child's progress, letting you know where your child is and where your child will, where our direction is, where we're going to be heading for that coming year, what we want to see your child accomplish. So Parent-Teacher Conference is going to be virtual, and so we're going to be using Google Meet. And the school will be sending out information. Also, the teachers will be sending out information. I know at the elementary, there's actually appointment times that we'll be setting up, so that you should be looking for an email coming, and you'll be getting a link to hook up a time with your teacher where you can call in and have that time to ask questions. So I think that's about it.
Yeah, thank you. This is going to kind of circle back around on a couple of things. So I just want to put it out there. We've done this from the start when we talked about students are in school, and we don't pretend that it's different than that. We just have a lot of mitigation measures in place, and we're being really safe. So the same kind of thing is going to come with activities of people needing to come into the school. So we're going to answer these, of course, but just to throw out there. So parent conferences, just like students when we're in remote learning and HPConc, we always want to have everything in the school. We know that that's the best practice. But right now we have to do things a little bit differently. So that includes the parent conferences, that includes our IEP meetings, that includes even many of our extracurricular activities, things that it isn't that they can't be done. That's not what we're saying, but kind of the opposite in the, abundance of caution, when they can be done more safe or they can be done differently, that's what we're trying to do. So it's the case in many of these things. So parent conferences at this time, because we're trying to protect the integrity of the schools being ready to have all the students in every day, and the contact tracing that would occur and the shutting down of schools if we have a positive case. We're just limiting to what we have to have in the school, which is our students, our teachers, and the instruction. So if we have to have something in the school, we will. But if we can have it another way, like virtually, we're going to do that for now. I know that the conversations have started, as they should, like anything. What is it going to take now to go from HBCon Bravo to HBCon Alpha? Well, I mean, we've got to establish the measures, look at the data, and then see, you know, if we can get there. But that direction is probably what we're talking about before we start talking about normal activities in the school, other than the students and the teachers and the learning. So I just kind of want to say that because it's going to keep coming around, so that it's kind of clear what we're trying to do is maintain it to what we have to have in the school. All right, sorry to interrupt. I think we are at Ms. Bryant.
All right, good afternoon. Our best friend during this pandemic is going to be technology. So although many things came to a halt during this time, communication is simply not one of them. So our chain of communication will simply be your teacher. If you still have questions or concerns after that conversation, you're welcome to join the admin team and have that further up discussion or meeting. And if we still can't resolve at that level, we can move forward to the district office. Okay, so again, that chain of communication will be the teacher, administrator, and then the district office. You can use email, you can use telephone calls, you can use Google Meetings, virtual meetings, wherever it is, we are definitely here to help serve and support you and your students. Things that I would like to celebrate for Humphrey Central are going to be our parents. You all have been absolutely supportive and extremely understanding at this time. We have seen a lot of partnership over the past 2 weeks and before those 2 weeks during remote learning. Lots of asking questions for clarity and being able to then enforce it with your own children. And I truly and greatly appreciate that. And you all have really been trying new things. So thank you very much. I also would like to celebrate our students. They have been very, very happy to return. And then the parents for helping us, for the ones that are still a little nervous about walking into quite a big building. The creative masks that we talked about earlier from another school, we've seen a lot of those too. And then also big shout out to the families that have created masks for our staff. We greatly, greatly appreciate you. And then showing their growth. Our children have not been afraid to show their growth, and they have also been really supporting their peers. So I really wanted to celebrate our students. And lastly, I want to celebrate our staff. You all are a dedicated group of educators, and I genuinely appreciate you. You are hardworking. This has been a vigilant team of educators. Between the kiss and drop, our morning duties, all of the mitigating measures that we put in place, they have been working and leading in love and not fear. Thank you, Humphrey Central.
Okay, Ms. Hahn, I think a little bit about our extracurricular and after-school clubs.
Sure. Good evening. Right now, we're looking at being able to start offering activities and after-school clubs for our students at the various schools. We're looking at mitigation factors that we can use with them to make sure that they stay safe, and things that we can continue to do with them online. So this information will be forthcoming from our different schools, and we are excited to be able to start bringing those back for our students. One of the things that I'd like to celebrate about our school, in addition to the kids being so excited to be in school, is the ingenuity of our teachers. They have come up with some wonderful ways to keep the barriers up on the desks. It seems like every time I walk into a classroom, somebody's thought of a different way. The latest one I saw this afternoon were sticky tabs stuck to Jenga squares, put on the desk, and they fit perfectly in the carry handles as they're sitting up, so they don't fall over anymore. So I just want to say you guys are awesome, and it's just exciting to be in these classrooms and see what's going on in there.
Thank you so much. Short, Johnson, can I take just a second before you start? No, she said no, I'll wait. Okay. So Ms. Hahn reminded me of a couple of things. This next section is about extra activities. And so as we move into those, just kind of a reminder again, safety-wise, it's like starting the day again when we get to extra activities. So that whole screening sheet, it starts over. So you're going to hear that a little bit, and we're going to talk a little bit about the activities. And then Dr. Bradley's going to remind us about our mitigation strategies again with all that we're doing. But as she mentioned, our barriers, this has been confusing, and this will be something that maybe even helps clarify for not just our students and parents and community, our administrators, our teachers, But maybe we'll remind each other because it's new to everybody, and so we're trying to get it down. But there's keeps being questions about our mask and barriers, so I'm going to reiterate that. So barriers are always up. When sitting down, barriers are always up. What we found is they're an additional mitigation measure, and there's not a reason not to have them up. So we can't find a good reason when kids are sitting down. I said this before, and then a kid asked me, like, so I'm supposed to carry my barrier around all day long? Like, no, that's not. When you sit down and it's the right time to use your barrier, the barrier should be up. The mask is on when we can't maintain appropriate social distancing. The adults are making the decisions whether there's appropriate social distancing. If there are concerns a child can ask about, or a parent, our administrators can help teachers to evaluate the situation. But we do have some situations where our kids are kind of close in proximity. So there are times when both the barriers and the masks are up, because the barriers are up all the time because there's not a reason not to have them up. The masks are on when we can't appropriately socially distance. So if we're not appropriately socially distanced and you're sitting down, there would be a situation where the mask and the barrier are on. So I know there's been a lot of questions about how come I keep hearing about both of them. The Department of Defense guidelines that we have in the CDC, but especially the DoD, talks about how other things don't replace the cloth face covering, that's a mitigation in itself. So we can't replace it with the barrier. We add the barrier as an additional mitigation. So, but when we can get social distancing and we can stay away, then we need to give those mask breaks so that kids have the opportunity to have a break from the mask. So sorry to jump in front of you, but I just wanted to make sure that I clarified that.
In the Pacific West, we're very excited that our high school sports season has started. It started October 6th for most of the sports and their practices. We are offering cross country, golf, tennis, both singles and doubles, cheer, and Pacific West is very lucky that we're the only district in DoDEA to offer both boys and girls volleyball.
Okay. So in order to ensure that our students are safe as they participate in athletics, as Dr. Arrington just mentioned a few minutes ago, the after-school activities, it's kind of like a restart to the school day. So we know our parents are screening their students before they send them to school with those signs and symptoms and taking their temperatures. And then after school, particularly in athletics, our coaches or athletic director will be meeting with every student, making sure, screening them for the signs and symptoms of COVID-19 and conducting temperature checks. So these steps are in line with guidance from our public health, the CDC, the National Federation of High School Sports, and with DoDEA. Again, the priority is to keep our students safe while at the same time being able to get back to doing some of the things that we need to do with our kids. Athletics is incredibly important, and we are very grateful to have that opportunity to be able to have our kids competing.
Mr. Grade, schedules and competitions.
The first proposal set is out up at the district level, and we'll be starting next week. Competitions, we hope we get all those worked out, and going through past December into that first couple weeks of January, and having some district competitions. But we're very excited to at least be able to have competitions with Osan and Humphreys, whether we're doing 2 teams or several teams, from each school. Being so small down here in Daegu, we usually can only field 1 team. So the proposals are at the district level now to get finalized, but we're hoping that those things we can get into place in buses, and our 10 days is close to for everybody in getting their sports, being ready to play and participate. And down here, we're picking up students daily, and so our numbers are growing. So I'm very excited for competitions and schedules for athletics.
Thank you, Mr. Grade. So a couple of things about athletics to share. First of all, Daegu is small in numbers, mighty in activity. So we'll make sure we recognize that. But our schedule, I'm going to reiterate a couple of things that different people said. We got special permission because of our command support and the mitigations and kind of safety consciousness of the people in South Korea and our bases. Special permission to add sports that, as was said, nobody else has. You have that, great power, great responsibility, all those kind of things. So we keep talking about it's wonderful that our students are getting an additional opportunity or multiple additional opportunities. But to keep those opportunities, we have to ensure that we are keeping all of the mitigation measures. So we're looking at indoor competitions with volleyball, which is not the case anywhere else. We're looking at doubles tennis, which isn't the case with anywhere else. We're looking at other potential opportunities in the future. Sorry, we had a phone go off. So with that, we have to keep all these precautionary measures. So we're trying to put a schedule together. We want the schedule, because we started late, to extend almost all the way until the spring season starts. And we did have a question posted that Dr. Bailey's going to answer after Dr. Bradley, but that schedule is not finalized yet. We're looking at competition. It is only intra-district, meaning that it's between the schools in Korea. So right now, the only permission we have, even though we have all the extra measures, is to compete between ourselves, between the DoDEA schools. But we do have these opportunities for students. So you're going to see a lot of focus on the safety and mitigation measures so that we can continue to have the opportunities. And so please know, as the kids do that, one of the big ones, is this part of yours?
Yeah.
Oh, I'm gonna hold that. I told Dr. Bradley I would stop right there before I took anybody else's. So I just want to reiterate that we're working everything we can, but we have to do it the right way. So, Dr. Bradley.
Good evening, everyone. And special shout out to the Osan Cougars and Mustangs and the Osan community. As you've heard before, we are lucky to be able to have sports, and especially our indoor sports of volleyball. There are a couple things that we have to put in place to make sure that we are able to continue with this privilege. And parents, we're really going to, and community, we're going to need you to work with us with it. As Ms. Graysack said, we'll have temperature check and screening. All players will be checked, the coaches during practices and during the games, officials will be checked. Also, we'll have the screening procedures in place. We're hand sanitizing often when players are not in the game. They're to wear masks. Coaches will wear masks at all times. Officials will have on masks at all times. For volleyball, and this is really important for volleyball, there are only 15 people per team, and that includes the 12 players, 2 coaches, and 1 manager. There are only 50 people in the gym at a time. So therefore, what does that mean? No spectators. Unfortunately, we will not be able to have any spectators, but we are trying to come up with a way to have live streaming. So again, working with us. Social distancing is going to be key. Again, we've been given this privilege with Pacific West to have indoor sports, and we want to keep that privilege. For those, when we're riding the buses to and from Daegu, there will be we'll have to stop because the drivers have to have a rest stop. But during that time, students will not be allowed off. In emergency situations, maybe to the restroom, but as far as going to the food court or any of those measures, no. So, and the coaches will reiterate when you're going to Daegu or when Daegu's coming up to Osan or to Humphreys, the students will probably need to pack a snack or something. Again, all of these measures are in place. to keep students safe, to keep the coaches safe, and also for us to continue to have these privileges. And as for the great things that are going on in Cougar Country, Mr. Romero.
Well, special shout out to our community. Our schools could not have done it without the community. The students are enjoying being back. They're following all of the mitigation factors. Of course, we have constant reminders because they're social. But even within that, they are so happy to be back. I would be remiss not to thank the command, who has definitely made it possible. We have such a strong partnership, and we continue that partnership. Nothing would have been possible than working with our district office leadership as well as the school's leadership, both in our Mustang Country and the Cougar Country. Our community has made it all possible. Our school has just been a happy place to be at. I cannot begin to tell you. The mitigations and all the new normal that we have is nothing. They all want to be in school. We all want to be in school. Our teachers are excited to be in school. So our community is happy that they're ready to fill. They're just skipping along. So we're very happy, a proud Pac West to have the schools back open even with the mitigations. We are proud to serve, and we're here to continue serving.
Cougars.
Go Cougars.
Thank you. The last question that seems to have come up in the chat box is related to sports. The question is about whether or not we are considering offering basketball as a sport that our children could play. Due to the abundance of caution that we are adhering to at this time, it is being considered, and the decision will be made the first or second week of December. Gotcha. Football is first or second week of December. But as we look at the environment, as far as we're in Bravo or Alpha, and if we have the appropriate mitigation strategies in place, we are considering basketball.
Yeah, and I'll say something there. So, and we try real hard not to come at anything with a deficit model. We've been talking about that recently to really come positive with it. So right now we have sports that have been approved, and those sports are wonderful. So we've got boys and girls volleyball, boys and girls cross country. We've got boys and girls golf. We got boys and girls tennis and doubles tennis added to that. We have boys and girls cheer together, and we have esports for boys and girls. That's a lot of stuff. Okay, we also have approved right now for the spring soccer, baseball, boys and girls soccer, baseball, softball, boys and girls. Boys and girls track. And did I miss one? Okay, all approved for the spring. So those are all the approved. So I'm coming at it as a positive. There were a few. Football is still on the decision tree for December 2nd. And right now, we do not have approved for basketball and wrestling. So those are not approved right now. There is a process for us to request approval. That's how we got volleyball and doubles tennis added to our sports here in Pacific West Korea. We can use that same process to make requests. It takes a lot. It takes our public health and our command saying that the measures are there. I'm not sure that currently we're in that situation yet, but I know that we're constantly looking at when measures reach a level where we can consider those things. But it's not a DoDEA alone decision. We package up with our command and our public health and our community a request, and then it goes through a chain of decision making to see if we can add that on. So I want to come at it from a positive. We have a lot of things approved to do for kids that are beyond just what's in the school. Those are not yet approved, and we're not sure if they will be at this point, but it's certainly something that hasn't been said, no way. We just have to have all those measures in place. So I know there's a long answer to that question from both of us, but right now, those have not yet been approved, and we do have a lot approved, but Football has not yet been approved. Right now, even less likely to be approved is basketball and wrestling. Okay. We had some additional questions. I'm hoping that you noticed that the questions we took and we answered within the discussion instead of kind of stopping and throwing out the question. Dr. Bailey still with basketball, we added that. There was things like the IEP meetings and the in-person activities, the parent conferences. We kind of put them into the meeting instead of having them separate. But what we're going to do is ensure that if there's additional questions that we're not seeing right now, that we will answer those in the comments from this video when people watch them in the future. So please feel free to share it forward. We appreciate your attendance. We are establishing ourselves in a virtual presence that we can come together like this. We're trying to get better. Be on the lookout next time for a Teams Live, Microsoft Teams Live. We're looking to transition over. Part of the reason is that we've gotten feedback from some of our military partners that they have a hard time where it's not allowed for them to view the Google Meets on their computers. This is Google Meets or Facebook Live, but the Microsoft Live allows us to go straight to you from Microsoft, which is generally approved throughout the military. So we're looking to make that transition also. One last reminder before we say thank you and cut out. So PAC West includes the schools in Korea and Osan, Daegu, and Humphreys. It also includes the schools in Guam. And so you'll hear sometimes the differentiation PAC West Korea, Pacific West Korea, Pacific West Guam, or just Pacific West. So we want to recognize that we are, and we try real hard to make sure that everybody understands we are one whole district. There are about 3,000 more kids in Guam. It's not like a small place. I mean, there's a lot of DoDEA students there. They have just gone back to HPCon Bravo 2 days ago. They are looking at starting school on the 26th, a week from Monday. And we will all be back in in-person school at that point, both in Pacific West as well as across all of Pacific region. All schools will be in in-person learning. So it's exciting times. I started out because students are always first, complimenting the students and recognizing them and that everything we do is for them. I'm going to end, though, by thanking, of course, all the people here we did and those that helped us technologically, but our parents through all of this have been our partners. It was 9 long months. Now we're coming back together, and now some of you have, another 6 months with us, and some of you have another 13 years with us. But you are our partners, and you've done a fabulous job. We continually look at ways to improve our communication, to partner with you, to share what we're doing, and improve our programs so that our students are successful in life. So thank you for joining us. If you didn't get a question answered, we'll get it into the comments. And we'll see you next time around. Thank you.